Hi, I'm Dr. Kurt Wohler for Sunrise Functional Medicine. The title of this video is Oxalic Acid and Unexplained Body Pain. So here is our disclaimer. Just understand that this is for educational purposes only. So if you've ever done an organic acids test, this particular example here comes from Mosaic Diagnostics, which used to be formerly the Great Plains Laboratory. They have a section on page 3 of their organic acid test called oxalate metabolites. Marker 21, oxalic acid, you can see in this particular case, is extremely elevated. And this can be elevated for many reasons. Dietary consumption of high oxalate foods, for example, but sometimes you can get high levels because of fungus production. So Candida can produce oxalate as well as Aspergillus, or at least certain species of Aspergillus can. So you always have to take that into consideration when assessing your particular organic acid test, or if you're a practitioner listening to this, the potential exposure that your patient may have to mold. So the organic acid test is a very comprehensive urine profile of different compounds that are representative of different imbalances in the body metabolically. But on page 1 of the organic acid test, we're picking up on organic acid compounds that are reflective of imbalances of various microbes in the digestive system, both fungal as well as bacterial. And for more information, actually, the ability to actually access an organic acid test on your own, you can go to Lab Test Plus. And Lab Test Plus offers a wide variety of functional integrative medicine testing, including many of the labs that come from Mosaic Diagnostics and other labs. For more information, again, go to labtestplus.com, or you can email to labtestplus@gmail.com. So some common complaints, some observations, if you will, of individuals who tend to have high oxalate problems. Sometimes sandy and grainy stools. It's kind of an interesting one. I've seen it in some kids. Not too many adults have commented about that. That's thought to occur because of high oxalates, perhaps. Bladder irritability, urethral pain, vulvar pain most certainly can be an oxalate problem. Pain on urination, but no confirmation of infection. Body aches, fibromyalgia-like discomfort, tendon pain, trigger point tenderness, increased tension in muscles, all can be associated with high oxalate situations. In some of the special needs kids, we sometimes see behavioral problems, sometimes self-injurious, aggressive behavior can occur. Eye pain, so poking of the eyes in some particular circumstances might be related to an oxalate problem as well. So this was a patient case from a number of years ago. This is a 43-year-old female. The main complaints that she had were pressure headaches, fatigue, brain fog, body aches, and tendon pain. Also had cyclical urinary pain and some digestive complaints. Now, she was on a few medications. What was interesting was that there was a past history of blastocystis and cryptosporidium parasitic infections, Raynaud's, which is essentially where your fingers go cold or numb or white when you're exposed to cold temperatures, and irritable bowel. The most curious symptom or complaint was this individual noticed severe muscle pain when she ate various nuts and vegetables. So her organic acid test at that time showed an oxalic level of almost 400, which is fairly high, not as high as the previous example I showed you. But you'll notice that glyceric and glycolic are normal. Those can be linked to genetic imbalances linked to oxalate problems. And glyceric and glycolic can also be high because of fungus exposure, particularly glyceric. So what's happening is that oxalate crystals form a chemical interaction with calcium, and it forms this calcium oxalate crystal, sometimes called a salt, like sodium chloride salt. Well, you get a calcium oxalate salt or crystal, and these crystals can get deposited throughout the body. Now, the organ system that is most vulnerable, or I should say maybe most susceptible to large accumulations of oxalate crystals, would be the kidneys. Many foods can be elevated in high oxalate content. So one of the problems with vegetable juicing, not all juicing of course, but some vegetable juicing or even smoothies, can be the very high absorption of oxalate if you're doing things like spinach or kale, for example, which tend to have high oxalate content within that vegetable. So basically, juicing spinach, putting spinach in a smoothie is really considered a no-go from an oxalate standpoint. So it really should be avoided, honestly. There are many other foods that can be high in oxalate. Certain berries, nuts, chocolate, teas. You can actually access, high oxalate food lists easily online. Now, when it comes to oxalate intervention, diet is important, just reducing the consumption of high oxalate foods. If we have a fungal problem like candida, it can be treated. Calcium and magnesium citrate can be helpful for binding oxalates in the digestive system. Various probiotics can also just assist in creating a more harmonious environment in the digestive tract that can help to lower oxalate content. Sometimes various B vitamins and magnesium deficiency can increase the potential for oxalate accumulation. And then other support. So other support would be things like Epsom salt baths, which provide magnesium sulfate or chondroitin sulfate. Sulfation chemistry is important in not only helping people detoxify, but the accumulation of oxalate in the body can actually compromise sulfate chemistry, where people just have a higher tendency to food reactions, for example. So these are just some other examples of things that can be done. In most circumstances with a low oxalate program, diet is key. So it's prioritizing to high oxalate foods that are known in the diet and eliminate those as best as possible. We can use calcium and magnesium citrate to help bind up oxalate in the digestive tract. Some type of high potency probiotic, Visbiome, for example, is just one example. It's a very high potency probiotic. Vitamin B6, other B vitamins like B1, even magnesium can be supportive as well. And then some cases, Epsom salt baths, for example, can often have a soothing effect. It helps with magnesium, it helps with sulfation. Sometimes it just helps with muscle aches and pains that people feel better with. Now, in this particular individual, when they implemented those strategies that I just reviewed or went over, there was about an 80% improvement in her overall complaints within about 3 months. So a low oxalate diet over a 3-month period of time completely resolved her bladder pain and improved the tendon and muscle pain by about 80%. Her bowels were more regular and non-painful, and the Raynaud's phenomena also improved. So the changes didn't happen over a weekend or just a couple weeks. It was something that evolved over about a 3-month period of time. And this individual went on from there and did very well and just maintained themselves on a low oxalate diet. And that was, essentially significantly helpful for them. So it really started with having a conversation, exploring the possibility of high oxalates, doing an organic acid test to see what the level was, and then implementing a strategy. For more information about our consulting practice, you can go to mysunrisecenter.com. You have our email at scmedicalcenter@gmail.com, and there is our phone number. So again, I'm Dr. Kurt Wohler for Sunrise Functional Medicine. Thank you.